Hello, my beautiful hospice family. Welcome back to DunsHospice. My name is Nurse Dawn, and I shall be a hospice registered nurse. In today's video, my beautiful hospice family, today's topic is one that many families struggle with, which is how can someone tell? How does someone with ALS qualify for hospice? If your loved one has been diagnosed with ALS, also known as Lou Gehrig's disease, this video could help you understand when hospice may be appropriate and why accepting hospice support is not giving up. It is one of the most loving decisions a family can make. ALS, my hospice family. ALS stands for amyotrophic lateral sclerosis. It is a progressive neurological disease that affects the nerve cells. You see, the nerve cells that are responsible for controlling our voluntary muscle movements. Over time, people with ALS may experience the following symptoms, okay? These symptoms include weakness in their arms and legs, difficulty with speaking, difficulty with swallowing, trouble breathing, increased dependence on others for daily activities. In my hospice family, unfortunately, ALS is considered a terminal illness, meaning that there is no cure for it. And while treatments may help to manage the symptoms, but currently, there is no cure. But we are hopeful and we know that by the grace of God, one day there will be a treatment. Now, my hospice family, I want you to know, I want to talk about what is hospice and what can hospice offer to my family. If you find yourself taking care of a loved one's diagnosed with ALS and you are asking yourself, what can hospice do for me? How can hospice help? Well, you've come to the right video, and please share this video with a loved one, with a family, with a coworker, with anybody you know who can benefit from this video. Thank you. Before we talk about qualifications, let's first begin by discussing what hospice really is and how hospice care can fit in. You see, many people hear the word hospice and they immediately think, oh no, that means death. That means my loved one is dying today, right now. But hospice is actually about living as comfortable as possible because hospice focuses on the following, such as comfort, dignity, symptom management, emotional support, spiritual support, and especially family education. You see, my hospice family, hospice is not about hastening death. Rather, it is about improving quality of life. You see? Now, generally speaking, a patient may qualify for hospice when the doctor believes that their life expectancy, okay, they have 6 months or less to live if the disease follows its natural course. But now I want us to remember that no one has a crystal ball, okay? You and I, we are not God and will never be. So no one has a crystal ball. Therefore, hospice eligibility is based on clinical decline, not an exact prediction. Because although the doctor gave you 6 months or less, we have people who has lasted a year on hospice, 2 years on hospice, even more than that. And at the same time, we have people who've lasted just a few weeks. Okay? So I want you to know that only God knows when it's time for you and I to go. Now, for our ALS patients, we look for specific signs and symptoms that the disease is progressing that will let us know. Okay? One of the biggest indicators One of the biggest signs that we look for to know when somebody is ready to be signed under hospice care with ALS is breathing, if they are having difficulty breathing. As ALS progresses, as a disease progresses, the muscles that help a person to breathe will become weaker, you see? And some signs may include shortness of breath, increased fatigue, difficulty breathing while they're just laying down, frequent respiratory infections like pneumonia, okay? They might need to now be on oxygen or even using a BiPAP or ventilator for support. So when breathing becomes more difficult, hospice may be appropriate. Okay? The second sign that we look for is difficulty with swallowing, also known as dysphagia in the medical world, which means difficulty swallowing. Now, some of the symptoms that the patient might exhibit would be choke frequently. You see? Do you notice them choking while they're eating the meals? Coughing during meals. Taking too much longer to eat, okay? Taking much longer to eat. And of course, having difficulty swallowing their medications. Rather than the person taking their meds whole with water, now it requires you to crush them. Difficulty swallowing increases the risk of aspiration pneumonia, and aspiration occurs when food or liquid enters the lungs instead of the stomach. And as you might imagine, my hospice family, this can become a serious complication. Number 3 out of the 5 main signs, main indicators to call hospice, my caregivers, is that your lovely one, your loved one, will have significant weight loss. You see, many ALS patients will lose a tremendous amount of weight, and that is because they are burning lots of energy simply trying to perform their daily activities. As swallowing becomes more difficult, nutrition often suffers, you see. And hospice may become appropriate when you see that they are losing a lot of weight, at least 10% of their body weight within the last few months. When they have poor appetite, when you notice muscle wasting, you see their face is starting to sink in. All right. And I know that families are often surprised by how much weight, that their loved ones has lost. And this is really difficult. Number 4, the fourth sign is dependence. As ALS progresses, patients typically requires increasing assistance, and they may need help with bathing, getting dressed, walking, because they often will fall down as their muscles get weaker. They're going to need help with eating and also with transferring from bed to chair. Eventually, many patients become completely dependent on caregivers. And this increasing level of care often places tremendous both emotional and physical stress on family members. Know that hospice can provide additional support during this stage. Number 5, the last but not least sign that I want us caregivers, okay, to be mindful of, to know when it's time to call hospice, is asking yourself, knowing that your loved ones will make frequent hospital trips. Frequent trips to the ER or hospital can definitely be an indication that they are declining and now it's time to call hospice. And some of the reasons to go to the ER would be if they have falls, if they're having a lot of falls resulted with injuries, if they're having respiratory infections, if they have a pneumonia, if they're being dehydrated because they're no longer able to swallow, able to eat. You see, these are all complications that are related to ALS. And hospice care, our goal is to reduce, okay? Hospice is to reduce the unnecessary hospitalizations by managing your symptoms at home whenever possible. Your hospice nurse, the hospice team, if you have a fall, you could call us at 2 in the morning. We'll be right there, okay, to guide you through it. If you have pneumonia, we'll be able to take care of that at home. You see? So these are complications that hospice can help you to manage, my hospice family. I would love to hear from you in the comment. Let me know. Have you ever had to take care of somebody with a diagnosis of ALS? Do you know a friend or a family or a neighbor who has gone through this illness, who has suffered through this? Please comment, let us share, because iron sharpens iron. Many families wait too long because they don't realize how much support hospice actually offers. Hospice may provide, and hospice will provide you with nurses visits, hospice aides. You'll have the social worker, the chaplain, volunteers, free medical equipments. Yes, I said it. Free medical equipments and also medications related to comfort. And know that these equipments may include hospital beds, oxygen, wheelchairs, bedside commodes, and suction machines, all designed to improve comfort and safety. During my career as a hospice nurse for over 10 years now, one of the most common things that I often would hear families say is that they are not yet ready for hospice. But often, what they really mean is we aren't ready to lose our loved ones. And that's completely understandable, you see. And please, my hospice caregivers, I want us to understand that hospice doesn't mean that you stop loving. Hospice doesn't mean that you stop caring. Hospice means that you are choosing comfort, dignity, and support during a difficult journey. In fact, many families later will tell me, Nurse Dawn, I wish we had called you. I wish we had called hospice sooner. Now, my caregivers, I want to leave you with a special message. If you are caring for someone with ALS right now, I want you to hear this. You are doing an incredible job. I know that there are days when you feel exhausted. I know that there are days when you are scared. I know that there are days also when you feel overwhelmed. But please remember, you do not have to do this alone. Hospice is not only for the patient, but hospice is also for the family. And this care, this wonderful care, will allow people to support you. It will allow people to walk alongside you. And also, it will allow yourself, please allow yourself to receive help. ALS is a challenging disease, but no family should have to navigate it alone. If your loved one is experiencing difficulty breathing, difficulty swallowing, significant weight loss, increased independence, and frequent infections or hospitalization, it may be time to focus. It may be time to discuss hospice with your physician, or with your local hospice provider. Please know that my hospice caregivers, the earlier hospice becomes involved, the more support your family can receive. If you found this video helpful, please give it a thumbs up and subscribe to DunsHospice. And share this video with someone who may need this information. And if you are caring for a loved one with a terminal illness, I want you to remember that you are not alone. There is help, and there is still life, love, and dignity every step of the way. Thank you for watching, my beautiful hospice families. I'll see you in the next video. And know that end of life is life. Thank you.